Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. Today there are 2 new cases of COVID-19 to report. The total number of cases to date is 284. As of this morning, 5 individuals are hospitalized and there are no patients with COVID-19 in the intensive care. As of this morning, 242 individuals are listed as recovered and we have 35 active cases. Yesterday, an additional 522 lab tests were performed. That brings the total to 28,294. In addition, public health officials have added 2 new cases to the small cluster of cases at a workplace in Prairie Mountain Health Region that we mentioned yesterday. This brings the total number of cases associated with that workplace to 7. Affected staff and their close contacts are self-isolating. Public health officials are working with them on detailed contact tracing, and this increase in cases is what we find when detailed contact investigation is done, and we find cases related to this cluster. Again, there is no cause for concern to the public regarding this. A thorough contact investigation is underway, and any risk to the public will be articulated in a timely fashion. This is not related to healthcare or to a food supply company and does not involve any significant interaction with the public. At this time, we're not sharing any further information about the business. Again, we've increased our testing capacity, we've increased our testing eligibility, and we continue to encourage Manitobans with symptoms of respiratory illness, fever, sore throat, runny nose, cough, to seek out testing. You can call Health Links for investigations for advice if necessary. Again, I encourage Manitobans to not fall behind on their regular health care. Our healthcare facilities are safe. Certainly keep in touch with your healthcare provider. If you need urgent or emergent healthcare, our facilities are safe. Please use the usual processes. Call Health Links for this. Call 911 for emergencies. We need to ensure that that everyone's aware there's more to our health than just this virus. So please keep in touch with your healthcare provider. Please keep in touch and stay up to date with your regular health plan. So to date, we've not seen significant community transmission of the virus or outbreaks in personal care homes. We've increased the capacity with our healthcare system, and that's why we've now looking at our numbers. It's a safe time to slowly, to cautiously open up the economy, and we're doing so in a very cautious manner, following our indicators that we have set forth very closely as we do this. It's something we made clear, though, this is not a return to normal. This is a gradual reopening. Things are not back to normal. We're in the beginnings of our new normal. So Manitobans still need to be aware of this virus, still need to take caution. We still need to be focused on physical distancing, on hand washing. And as we move forward, as we open things, it's extremely important that those with symptoms of illness do not go out in public. Do not attend work even with mild symptoms. Do not go shopping. Do not meet with friends if you have mild respiratory symptoms. You should stay home if the symptoms are mild. Stay home for 14 days. If you have respiratory symptoms, certainly you're eligible for testing. You can call Health Links for more advice. But it's vital that we do not have ill people showing up in public. We talk about this virus, how it's spread through prolonged close contact, predominantly through people who are showing symptoms. So the best way to limit the transmission of this virus is to not have contact with others when you're showing signs of illness. So we're definitely not letting our guard down. Manitobans have really stepped up to put us into this position to be able to gradually reopen the economy. And Manitobans are continuing to take cautions, to stay home when they're ill, when they're out, to maintain that physical distancing whenever possible. These actions that we're going to take over these next weeks to months are really crucial to maintaining our current status. We don't have targeted treatments right now for this virus. We don't have a vaccine yet for this virus, so our public health measures are vital in our approach to this at this time. So what we've talked about in the past remains true. Practicing good hand hygiene. Avoid touching your face, eyes, washing no frequently touched surfaces. Continue to stay home and spend time with your family members, especially if you are have significant underlying health conditions, those over 65, those with underlying medical conditions, those with immune compromise. Others, as we gradually reopen the economy, need to still be wary of physical distancing and staying home when they're ill. We continue to advise against personal non-essential travel. We know that as Manitoba's numbers have remained in a good position, we are still at risk for the importation of this virus, so we need to limit the chances of that. Certainly people coming back from international travel are required under the Quarantine Act to self-isolate for 14 days. Those returning from interprovincial travel are also required to self-isolate for 14 days. We need to limit the importation of this virus into our province. And again, as we gradually move things forward with our economy, as we gradually open things up, it's still important that those that are at increased risk of severe outcomes still take extra cautions. Those over age 65, those with underlying medical conditions, those with immune compromise, we need to continue to stay home for the most part. If you do go out for necessary reasons, physical distancing at all times. Businesses that have questions about the reopening plan can contact engagemb.ca for further information. And we know Manitobans can access manitoba.ca/COVID-19 for up-to-date credible information on the outbreak. So thanks again to all Manitobans, and I'll pass this over to Lynette.
Good afternoon, everyone. I'm Lynette Siragusa from Shared Health, and I wanted to begin today by acknowledging the terrific work teachers and school administrators have been doing to keep kids engaged in learning under these less than ideal circumstances. And I want to congratulate parents from throughout the province who have persevered after unexpectedly having to take on the task of homeschooling their children. A few weeks ago, staff at Royal School in the Pembina Trails School Division sent out a social story to help young students understand why they can't be at school with their friends right now. And a parent of 2 students at the school saw this great work, and then they upped the ante by turning the social story into a video and adding music. We will post that later on our Shared Health social media channel, but it is a great video that helps kids to better understand why we need to stay at home and socially distance from one another and regularly wash our hands. So this video is a wonderful example of the hard work both teachers and parents are putting in right now to help kids navigate through these very unusual times. So congratulations to the staff at Royal School for putting this together, as well as Jen Wilder and her kids Ali and McKenna for putting their spin on the work. Great job. I'd also like to provide an update on the health of our clinical providers. So we continue to test staff members, and we have tested in the past week 546 staff members and first responders. They've come back negative. That was between April 29th and May 5th. We continue to have 25 non-travel related cases involving healthcare workers. There's been no new positive cases in the past week. 23 of those 25 staff members have returned to work now. And so we're very happy that they made a recovery, and we wish those two still at home a healthy journey back. I also wanted to give you an update on the single site staffing restrictions that were successfully implemented last week at all 127 personal care homes throughout the province. It was a measure that was made to lessen the risk that long-term residents face from COVID-19, based on the evidence and the outcomes that we were seeing in other provinces throughout the country. So as the restrictions loosen across the province in a number of areas, our need to protect the vulnerable high-risk patients remains of paramount importance to us. With that in mind, there are a number of independent contractors within regulated professions who provide service within the healthcare system, including inside personal care homes. This might be physiotherapists, foot care nurses, and very important services as well. So I would like to ask these private contractors to seek guidance from the health regions in which they work in to confirm their safety can be resumed safely and what the protocols and processes should be when you travel into these personal care homes. But we do want to say that they are important, and we do want to make sure that residents have access to your services, and we can work with you on how to make that happen. And with that, I think we can open the line to questions.
Thank you. A reminder to our reporters online. You will have one opening question and one follow-up. Up first this afternoon from Canadian Press, Steve.
Steve Lambert from the Canadian Press. Dr. Roussin, you mentioned two new cases in that cluster, and I know that you're not revealing the location. Is it a very large employer? Are there dozens and dozens or hundreds of employees to be tested, and you're just sort of making your way through them, or have most of the employees been tested at this point?
That's right. Yeah, most of the contact investigation has already been completed. There's been a lot of testing done, and so there's, still with new cases. Obviously, now there's some more contact investigations to begin, but there are not a lot of contacts that are pending so far.
Okay. And we're a couple of days into the reopening of some non-essential businesses, patios, and the like. Have you heard any reports about any issues that have cropped up with compliance?
Yeah, actually, I haven't heard of any major issues or enforcement requirements at this point. So I think there's, people getting used to the idea, and just like with our previous orders, the vast majority of Manitobans were compliant, and we'd expect that the same. Most of the enforcement is going to be around education, just answering questions, ensuring that businesses are aware of what's required and provide advice on how they can comply and how they can protect their employees and their patrons. But certainly there's the option of more enforcement if possible, but I haven't heard of any major events as of yet.
Thank you.
From CTV Winnipeg, John.
Hello, John Hendricks from CTV News. This is a question for Ms. Zaragoza. I'm wondering if you could give us an update on the N95 mask situation. I'm wondering what the supply is like, and if you could discuss when the last shipment was received and how much you received.
I don't have the details as to when the latest shipment of N95 masks came in. I know we still are waiting for more to arrive. My understanding is that is one of the priority supplies that we continue to watch closely and monitor. They are in short supply, but my understanding is that we do have, at least for the next 2 to 3 weeks, we have adequate supply as we wait for more to come. And also we continue to work on reprocessing the N95 masks as well as the 3D printing underway. So between all of that, so far so good. And if there's any changes, we absolutely will let you know.
Thank you. My follow-up question is for Dr. Roussin. We've heard from some other jurisdictions that school, once it resumes, will have to be quite different. I'm wondering if Manitoba Health has begun to contemplate what school will look like in September, what restrictions may have to be put in place, whether distance learning will have to continue.
Yeah, we've been looking at all those options, and certainly things can change by the time fall comes around. But certainly we've looked at at what things could look like, and so it's we're still going to be dealing with this virus. We're still going to need to have ways to deal with physical distancing. We know that it's not possible for the entire day, but there are things that can be put in place. We can try to do what we can to limit class sizes, can ensure decreased prolonged contact by spacing desks out. There may still be options for, say, virtual learning going forward, but these are all up in the air. They're just options that we're looking at. Certainly avoiding large assemblies and these type of things. What's really going to be vital, and it's the same thing as what we see now, is that we need to change the way we approach things, and we cannot have children or staff coming to work with symptoms of respiratory illness. And so it's just vital going forward that there's policies in place that can really react to that quickly. And so lots of hand washing, physical distancing where possible, but it's going to be vital that we have policies in place, strict policies to avoid people with illness coming to school or to work.
Thank you.
From City News, Stephanie.
Hi there, Stephanie Lesuk with City News. Dr. Roussin, I'm just wondering, as Steve mentioned, we are a couple days into the restrictions loosening, and we're still getting pictures of a lot of full restaurant patios or soccer fields where there seems to be a large number of people gathering together. How much has enforcement had to step up over the past few days? Or can you give us numbers to tell us, kind of what the enforcement team looks like?
Well, I don't have specific numbers of that. We have a number of public health investigators within the city that have really good relationships with a lot of establishments, and so they're getting out there, they're getting the message out, and providing advice where necessary. So, I think it's that message is that this is not a return to normal. So I know that we've had very stringent restrictions on Manitobans for quite some time. We were committed to trying to loosen those restrictions as soon as it was safe, and that's why we moved in this direction. But it's not a return to normal. People need to still take those cautions, and we'd expect business owners to be responsible for this. So we can't see crowding on those patios. They need to be respecting the space requirements. Certainly outdoor environments, the chances of transmitting the virus, certainly through casual contact, is very low. So that's why we're focused a lot on outdoor environments. But those orders are out there. They're enforceable, and we're going to hold people accountable to follow them.
Thank you. And then just a question for Ms. Siragusa. Can you tell us how much the province has spent on PPE since the pandemic started here?
No, I can't, but I will find out for you.
Perfect, thank you.
From the Winnipeg Free Press, Kevin.
Hi, I guess this is for Dr. Roussin, assuming you can hear me fine. That from what we understand, that people who were tested and then who were found to be positive, that they're being asked if they'd like to identify themselves as Indigenous, First Nation, Métis, or Inuit.
So there's on the intake questionnaire for cases, then that's they're asked to self-identify, and so it's a question that's asked of everyone. It's certainly not mandatory for a person to answer, but it is for the cases. So we don't have details on the amount of people who are, say, tested based on many identifiers. But active cases are asked that question.
And then what we understand that the First Nations leadership, there's an agreement that's been worked out to pass information to them. We understand it's not been settled with Métis for MMF. Wondering why that is and where that information is going to at this point in time.
Yeah, so there's a large collaboration. It's been in place for some time, but the data sharing agreement was signed with many of the Indigenous partners, and so it does have that that data collection. I don't necessarily have the specifics of MMF where they lie in it, but it was a collaborative process. I think it definitely respects the OCAP principles, and real move forward with the collection of this data, the analysis, and then potential sharing of it if everyone in the collaborative feels it's necessary.
From Global, Marnie.
Good afternoon, Marnie Blunt with Global News. Dr. Roussin, in regards to the cluster of COVID-19 cases in the Prairie Mountain Health Region at a workplace, can you confirm if that is connected, or any of those cases, or that company is connected to traveling either interprovincially or internationally?
So yeah, we're not going to release any more information about it. We mentioned it's not a healthcare facility or related to healthcare provision. It's not related to the food industry. That's big because in other jurisdictions we've seen some outbreaks related to that. So the contact investigation had been largely completed. We have 2 new cases. And so we're not concerned about a risk to the public. If there was, we'll definitely be articulating that as soon as we can. And so that's all the details we're going to release of that workplace.
And just as a follow-up to that, I know you said you're not releasing any more details, but Global News has learned that it was connected to a trucking company potentially, which one could argue that does involve public safety with a trucking company that maybe is traveling over borders and transporting goods. Can you confirm if that's the case? And if not, why wouldn't you confirm that?
Yeah, I can confirm that if public health felt that there was a risk to the public, we would be articulating that. So that's the details that we're releasing.
From the Brandon Sun, Bud.
Yes, Bud Robertson, the Brandon Sun. Dr. Roussin, just to continue on that vein, not naming this, the workplace or the location, it has created a great deal of concerns here, rumors, fears. If you cannot name the company involved, why can you not at least name the type of business, what the industry is as opposed to what it's not, and perhaps quell some of the fears that seems to be making things worse?
Yeah, so what we talk about to Manitobans and what we try to get the message out is to follow credible information, to visit our website, and that public health does thorough contact investigations of each and every case, and so certainly including this cluster. So if public health felt that there was a reason for the public to be anxious, or there was a reason that the public was at risk, we would be discussing that with the public. And so follow credible advice. And at this point, we're not releasing any more information about that business.
And as a follow-up, do you advise workplaces or companies where there's a case not to divulge that information to the public themselves?
It's for a workplace, if there was a single case, it depends on the extent of the contact investigation. So we'd be dealing with the case for sure and any contacts. We would involve the workplace if we had reason to believe there is significant contacts within there. And so we don't, advise, anybody what to do with their own information. It's just we would be doing our contact investigation and case investigation.
All right, thank you.
From CJOB, Diana.
Good afternoon, Diana from 680 CJRB. Just to clarify, are the two new cases being reported today those that are linked to the cluster in the Prairie Mountain region, or are they cases, are the two new cases linked to the cluster ones that have been announced previously that are simply being linked to the cluster today?
That's right. So the two new cases today are linked to that cluster.
Okay, and are we expecting any more cases from this cluster? I know you said that contact tracing is kind of not quite wrapped up, but it's getting there. Are we expecting this cluster to grow?
It's certainly possible, right? We have two new cases, so there may be more contacts that weren't contacts of that they had in common with the other cases. So we'll look into that and advise contacts to be self-isolating. There's contacts right now that are still self-isolating, right? So we're still in the incubation period for many of the contacts, so we sure could see more cases, but this is right what public health is all about. If we see new cases and people who are self-isolating, then we've dramatically reduced the number of contacts that they've had, and then this cluster eventually goes away.
From the Winnipeg Sun, Scott.
Scott Billick, Winnipeg Sun. Question for Dr. Roussin. Can you clarify what a cluster is and when it would be considered an outbreak as opposed to just, I guess, a cluster or just a group of cases?
Yeah, and there's no specific definition that fits with there. So, an outbreak of an illness is really just more than expected. And so the definition might vary for different conditions. When you speak about a cluster versus outbreak, we'll usually refer to a cluster when we have a very tight geographical area. So if we had in one facility, we'll probably refer to it as a cluster. It wouldn't be wrong to call it an outbreak. But an outbreak will usually reserve for a larger geographic area, but it's sure not wrong to refer to it as an outbreak. If we have a respiratory illness in a personal care home, we'll usually refer that as an outbreak as well. So there's no definite line.
Fair enough. And my follow-up question: at what point? And I know you've talked about enforcement and education and stuff like that. We're 2 months into this. At what point do people should already know all of the, this stuff is drilled into people every day. Businesses obviously have only been open or some have been open for 3 days. But, I imagine, patios and stuff like that. These businesses should know what a crowded patio looks like or whatever. Why isn't enforcement maybe taken more seriously on the monetary side? To ensure compliance instead of just education.
Yeah, so it's certainly not just education. I'm not aware of any tickets that have been issued since just reopening. It's been a few days, but there have been tickets issued during this pandemic. So it's certainly not just an education piece, but what we find out just in general with businesses, with Manitobans, is that the vast majority follow advice. And they follow advice well. There's a small amount that aren't following it, and the reason why is they just weren't quite on the same page, didn't know what the requirements are, and as soon as they're advised of it, they do begin to follow advice. And then there's just that very small amount that require the more stringent enforcement policies. So this is the way things have worked. If you look at Manitoba's numbers, we've done well, and that's because of Manitobans stepping up. So we expect that same thing, but to have that ability to issue tickets, have that ability to enforce is important, and it's certainly there, and it will be utilized. We need to be all on top of this as we move forward.
From CBC Radio Canada, Laisa.
CBC Radio Canada, Laisa. As for Dr. Roussin, Dr. Roussin, the Union for Food and Services Workers is asked for more detail on wearing a mask and hasn't gotten a response. Can you please clarify the recommendation for employees to wear masks for work in a restaurant, and in what situation is it mandatory?
Yeah, so good question. So if we're talking about things moving forward, again, any question about protecting yourself or others about this virus always will come back to the basic things. And right now, as we reopen things, the most basic thing, the most important thing is that we can't have symptomatic people showing up for work or in public. That's the most important thing. We need to maintain physical distancing when possible. We know for sure that that's not possible at all times, but it is possible many times, and so we need to limit close prolonged contact, and then there's some strategies with that for many workplaces. Now, non-medical masks, nowhere in our strategy are they made mandatory, but they are an additional precaution that people can take. What we need people to be aware of are the limitations of it. To be aware that when you wear a non-medical mask, you're not protecting yourself. You're adding protection to people around you. And it's not a substitute for all those things that I just listed. It's not a substitute for then coming to work with mild symptoms, or a substitute for not washing your hands, or a substitute for trying to maintain physical distance when at all possible. So we don't make them mandatory. There's certainly places for them, but we just want people to be aware of what they actually do and what they don't do.
If the province has any plans to help those businesses that are finding it hard to have personal equipment for protection?
At this point, so our personal protective equipment, is really vital for our frontline healthcare workers. They are, dealing with cases or potential cases. They can't avoid prolonged close contact often with these people, and they're wearing the PPE protect others as well. So that's where we're focusing our PPE plans on. And so for the private sector, for businesses, at this point, we need to have our PPE in the hands of the most at risk, and that's the healthcare workers.
From CBC Manitoba, Marina.
Hi there, Marina von Stackelberg from CBC News Manitoba. We are hearing the dentists are using the P100 respirator mask to protect against aerosols. They're doing this in place of the N95s that aren't available. These P100 masks, I understand, are usually for industrial use, for things like chemicals. What do you think of this idea, and is it safe?
Well, so we've provided certain advice to various healthcare practitioners. PPE has been a developing issue because of the worldwide demand on it. Certainly, the practice of regulated health professionals are guided by their professional organizations. And so we would certainly collaborate with them if they had any opinions on this, but the specific advice on that should come from experts in that area, in their area of practice. So I don't really have a specific comment on that.
Thanks. And to follow up on that, we are hearing from the Dental Association that it's not something they are necessarily recommending one way or another. But can you comment on just the P100 mask? Is it as effective as a P95? Would it be a good alternative?
Yeah, so that would be one that we could provide some background information on it. That I would prefer to have a infection prevention and control expert talk about things like that. So I don't think I have a something that I want to put out there right now. I would ask the opinion of an IP&C expert on something like that.
Thank you.
From the Globe and Mail, Eric.
Hi, this is Eric Andrew from the Globe and Mail. You began collecting data on the ethnicity of COVID patients in the province recently. What was the rationale for that decision, and would you urge other provinces to follow suit?
So I think the rationale is to, to collect epidemiologic data that we can analyze to see if there is a, say, disproportionate effect on certain groups. And unless we collect that data, we're not going to know. So it was put in place after a lot of consultation, done so in a confidential manner. And certainly it's not mandatory for any client to answer questions if they don't feel comfortable with it. But we have it in place. We have the ability then to analyze that data, to disseminate the data in an appropriate manner if necessary. But it's, it might show us whether there is a disproportionate effect on that, and unless you collect it, you can't. So, as far as what other jurisdictions do, I'm not here to comment on that. I think that each jurisdiction is going to need to assess what's best for their province. So I would leave that with them.
From the Flin Flon Reminder, Cassidy.
Hello. We have seen nearly 3 weeks with no cases in the Northern Health Region. Do you think the virus is still active here?
We have to certainly deal with this virus still, and so I would say you're right. We don't have diagnosed cases there, but that shouldn't change people's behavior. Every Manitoban right now should feel that virus is out there in the community. Our numbers have put us in a good position that we can start reopening the economy slowly, cautiously. But no matter where you are in a province, I would not let up on the idea of physical distancing. I would not let up on the idea of washing your hands frequently. And I certainly wouldn't let up on the idea of staying home when you're ill. Do not attend work. Do not go out in public when you're ill. Certainly attend for health care if you're ill, but we can't have people showing up to work even with mild symptoms. So it's a good question. I think it's a reflection on Manitobans' efforts to put us in this position, but we can't rely on numbers like that to change our behaviors. We're going to be dealing with this virus in one way or another for quite some time.
And we've seen, to the point, we've seen outbreaks in northern Saskatchewan as well, and Saskatchewan is ramping up their border controls. Any thoughts of ramping up the border controls either at the Saskatchewan-Manitoba border or along the highways traveling to northern Manitoba?
So, right from the beginning of our response here, we don't have any, good ideas that are off the table. And so we've put in the northern restrictions, the public health orders. We've put in the mandatory 14-day self-isolation for interprovincial travel. So we have those in place right now. And so certainly we have things on the board. If we need to escalate, we can. But as of this point right now, that's not something we're doing.
Thank you. We have just a few moments left. If any of our reporters online have one or two more questions, please ask them now.
Good afternoon, Dr. Roussin, we understand you're not releasing any further information on this cluster. Could you please explain why a trucking firm that hauls interprovincially would not maybe cause you concern to kind of release that level of detail?
Yeah, so when we have concern about a case or a cluster, if we feel that there's people in the public that may have been exposed to it that we can't reach through a contact investigation, we're going to disclose that information. And so that applies to this cluster, it applies to a single case. So when we have a cluster of cases, when we have a single case, when public health feels we've reached all the close contacts of this person, then that tells us there's really no benefit to the public being advised of where this is. And so that could change. We're going to follow this closely, and if we ever get an idea that the public may benefit from the release, then we absolutely will. But right now, our contact investigation tells us that that's not the case.
Thank you. Follow-up from the Globe and Mail. You've been collecting data on First Nations identity among COVID patients since the beginning of April, but not releasing those numbers publicly. Will you be releasing the similar data you collect on ethnicity publicly?
It all depends. We have processes in place to analyze and to release when it's appropriate. And so some of those things are, if the numbers are really low, then we're dealing with privacy issues. And so so it really depends. So we have the ability to release that, but only in appropriate circumstances. We need to ensure we're protecting privacy. But there is the possibility of that if it's appropriate.
Kevin Rollison at Free Press. The one we've had family members call us. Is there any move to change the visitor restrictions at either long-term care facilities or acute care, or take another look at it as we go on?
Yeah, we certainly will continue to reevaluate that, and the team is working on what that would look like. So it won't be in the next week, I don't think. We want to just watch and make sure with the staffing changes that just happened recently that everybody's safe and stable, and then we will be looking at when we can open up and loosen those restrictions as soon as possible.
Dr. It's Scott from the Sun again. Just wondering do we know how much testing is happening in the north, or do you guys have that number? Is it adequate to suggest that there isn't the virus up there at this point?
Yeah, so I don't have the specific numbers, but again, regarding the testing numbers and missing a substantial number of cases, I always refer back to that we definitely are testing everyone with respiratory symptoms that are in ICU or in a hospital. So remember that 10 to 15% of all cases we expect will be hospitalized. And so our hospital numbers are quite low. And so, that really goes, against any thoughts that there's a large hidden epidemic anywhere in the province.
Marina Bossackberg from CBC News here. We are hearing from a lot of restaurants who are saying they're really looking for clearer recommendations on wearing masks and PPE. Can you give any sort of guidelines on this? They say a lot of the resources online are not clear. Perhaps, what sort of jobs should be wearing these masks if they can?
Yeah, and so, our messaging is fairly clear on this regarding masks. It's that they are sort of the last line. We have much more important things that we can all do, and that is, one is to not be going to work ill, not be going out into public ill, frequent hand washing, certainly following the advice of public health if you're advised to self-isolate, and physical distancing. And so physical distancing is possible. It may not be possible 100% of the time, but for the most part, we should still be aware of the physical distancing and the necessity to do that. And then, on top of that, people could choose to wear non-medical masks. But again, only if they realize that it's not protecting them, it's protecting the people around them. And that's not a substitute for all those measures that I just mentioned.
Kevin Rollison of Free Press, a few weeks ago you were advising what Manitobans should do to celebrate Easter dinner with loved ones. We've got another occasion for those who don't remember coming up on Sunday with Mother's Day. What advice would you give now that we're into this about seven weeks?
Yeah, so it's we're not done with the virus, and we're not back to normal. And so I'm still going to be recommending against large family gatherings. So we're going to keep that number to 10. We know that the risk of this virus is spread through prolonged close contact, more so indoors than outdoors. So if you're meeting with family and you can do it outdoors, then better. If you can do it outdoors and maintain physical distancing, then even better. But certainly no one showing up to any type of gathering like that with even mild symptoms. Everyone's washing their hands. And then be wary of people who are at increased risk of severe outcomes. So those over age 65, those with underlying medical conditions or immune compromise, they are more susceptible to severe outcomes. So we need to be extra cautious with those.
Thank you. This concludes today's media briefing.
Thank you.